So thank you to have accepted the presentation. Disclosure first, we have this project was co-funded by the French Ministry of Industry, and the objective of this project is to facilitate the navigation and the work in endoscopic and NOTES surgery. You know NOTES, you have a flexible endoscope, you need to go inside the patient, and the main problem you know is the fact that you have a flexible endoscope. Because due to this flexibility, when you have your hand onto the handle, you know where is your hand, but you don't know where is the end tip. And this problem is really known, and as you can see here, it creates difficulty to know precisely where you are. You see between the first and the second image, it looks like similar, but you have a rotation of 90 degrees. And with the third image, if I ask you where is the up, the left or the right, it's really difficult to say. Of course, if you have such nice 3D imaging, you know where you are, you know what is your shape of your endoscope, and it's much more easy. Existing system currently cannot provide a solution for all the problems that exist. If you look, we have an approximation of the endoscope position tip, because we can see, thanks to the endoscope, we know about where we are, but it's only an approximative location. We have absolutely no knowledge on the endoscope location. I speak specifically onto the coordinate in the space, and no knowledge onto the endoscope shape. Moreover, we have currently only an approximative estimation of distance on side, which is only a visual estimation. So to solve this problem, you know that it exists the scope guide from Olympus. There is some other system based on electromagnetic coils, and it exists also an optic system developed by Luna Innovation from NASA, and they have a partnership with Intuitive Surgical. So it exists solution to provide the 3D shape of the endoscope, but it is only the shape. And all the other problems are not provided. So what we propose is very simple. We use exactly the same kind of system. Here it's an Aurora developed by NDI. You can find it onto the market really easily. And it provides you the shape, okay, like other system. What we will add is to provide an external view through a simple cyanotic camera, for instance. So now you have the skin, thanks to this camera. All OP room have a camera. You can also, sometime, have a preoperative 3D reconstruction. You know coloscopy. Virtual coloscopy is also available now about everywhere. So if you have this system, why not combine the 3D shape with the external view or the virtual view? It's what we call augmented reality. And this technique could, of course, improve the results. To evaluate the potential and to prove that it is feasible, we have asked to NDI to develop this flexible shape sensor. You see that it is based on a set of electromagnetic coils that you can know where you can know their position in the space. They have developed two kinds of flexible scope. You see the first one is 5 doves shaped tool. The second one is 6 doves. That means that when you rotate, you can have the rotation information. The size that you can have is about 84 centimeters for the 3D shape. So now when you move this flexible tube inside the field, as you see here, you can have the 3D view of the scope, like, again, scope guide, or like other system existing. Now the difference, as I said is to combine that with other system. Precisions that are available are known. There is nothing real new. It's only to show you that all existing systems I know with electromagnetic field have about 2 meters of precision. If you use such tube now, you can do something else that is new. Because it's a flexible tube that you can introduce inside the endoscopic operative canal. You can also put the tube outside of the canal and take measure. And if you do that, you see that the maximum error that we have computed on a last set of evaluation is under 1 millimeter. That means that only with this simple tube, you can have a really accurate way to measure inside any area in the abdomen with a flexible tube. Second point, as I said augmented reality. To do augmented reality, you need augmentation to perform. So first of all, you can have, as I said a 3D modeling. In ERCAD, we can provide such nice 3D reconstruction because we have a service that provides more than 300 such clinical cases per year. And you can also have, thanks to our algorithm, an augmented reality. I was presented such work yesterday, and so it's a set of systems that exist today, from interactive process to much more complex like this one, fully automatic process. And now if you combine these two systems with the shape system, you see the result that is really interesting. With the cyanotic camera, you have the view of your target. Here it's a mannequin. You can see onto the mannequin the electromagnetic field generators, where we have stick markers to know where it is. And when you put your flexible tube, you can see it superimpose, as you see now, normally. Now you see, superimpose onto the video. So you know the shape, of course, but you know also the location. And when you introduce it inside the mannequin, you can see the shape inside the mannequin. Now if you combine that with the 3D reconstruction, you will see not only the external view, but you can superimpose organs if they have been reconstructed. So onto the right down part, you see the organ in 3D. So you have the external view, but you have also anatomical structure. So we have tested this system onto pigs, as you see here, for notes. And you will see that it provides a really interesting result, because with these shape tools introduced in the operative canal, you can see your flexible endoscope around organs, thanks to the virtual view. You can also see the augmented reality, as you will see at the end of this video. You can have organs superimpose, you can have the skin, etc. So the conclusion, with such system, the metrics provide a 2 mm accurate endoscope and tip location, 2 mm accurate endoscope location and shape, 1 mm precise distance and size measurement, so what we can expect, and what if we compare with existing system, we have largely more information than in the past. So now the future work consists to do a human validation. Normally it will start in May. We are waiting for the CEO approval of the system, and we will see what kind of benefit we can have with all this new information. Thank you for your attention.